I actually went to Arizona School of Dentistry and Oral Health in Mesa, Arizona. And if you don't know, that dental school is very public health oriented. And I went there for a reason. I am Navajo, and I wanted to go back to my community because I know there's a huge access problem. And also, to be honest, you know, many of the people that are living there, can they go to the dentist and do they trust their judgment in providing them the best care? That was one of my concerns, and so that's why I went through school and I became a dentist, and now I went back. I did go to Alaska out of school. I spent 4 years there, and I did work with the DHATs, the dental health aid therapists, for the 4 years that I was there. And while working with them, I did supervise as well. After being in Alaska, I did move down to Ganado, Arizona, so I returned to the Navajo Nation, and I worked there up until recently, and now I moved to New Mexico. I'm originally from New Mexico. I grew up in Aztec, New Mexico, and I went to school all through, you know, from kindergarten up to high school. So returning back home was really nice, and I'm enjoying it, and I plan to work with the Navajo people still in Shiprock, New Mexico. What I wanted to go through with you, I know that you've heard a lot of what Stephanie has said, and you know, Pam as well, and I don't want to, you know, be redundant, so I'm just going to go through mine really quick. The dental therapist in Bethel, I still keep track. I'm very interested in what's going on because really, for me, I see it as the future. I think it's the future of dentistry. Currently, they have 25 dental therapists certified in all of Alaska, and 4 are right now in preceptorship, meaning that they're going through their 6-month training. 9 of them are still working with YK. As you saw, Stephanie has said she's been working for 9 years now. 8 are certified and are in villages. These numbers are particular for Bethel region. So if you're not familiar with Alaska, you fly up to Anchorage and you go west exactly maybe 300 to 400 miles, you'll run into Bethel. There's no roads there, you have to fly there. I really enjoyed my time there. I like working in isolated rural areas. Why? Because I became a dentist to serve the underserved, to give access to people who really need it. So taking on this with the dental therapist is really close to my heart because I really feel like, again, like it's something that we need to consider. One of the other things with supervision, I know Stephanie kind of talked about it, just to give you a little bit more specific perspective on that. The way that I would supervise a dental therapist is they would come in, they would work with me closely, they would tell me what the patient's here for, they would do a whole case history with me, and then we would go see the patient. I would ask them what the diagnosis is, we'd go through the x-rays. This was continually every day for 6 months. And the type of work that they're doing is very simple procedures. So she mentioned simple extractions. Now, do we know what that really means? What that means is that a tooth with a single root, those are the kind of extractions that are being done. Now, if the crown, the part that you see, is broken off and you have to go underneath the gums, that goes into my area. That becomes a surgical extraction. And that's when I would see that patient and remove that tooth. Molars, so I hope none of you have had to experience an extraction with a molar, but that has more than one root. And so sometimes that can become very complicated and you can't predict if that's going to happen. So that's the reason why with a dental therapist, we don't allow them to do that. Instead, you know, that goes to a dentist. So that kind of hits on my point of, you know, as a dentist, I think some of us might be concerned that, you know, if we allow these dental therapists to start working, is that going to take away the credibility from us, or even is that going to not provide us well, if not, is that not going to provide quality care for the patient? And I disagree with that. The dental therapists are taking their time. They don't want to do a bad job. They're from that community. They care about the patients. They're going to be checking with us almost for every single thing. That was my experience. So, you know, for me, I think with the dental therapist being there as well, They have cultural competence. I know that was talked about. I want to give you a quick story. It won't take long. But, you know, being from the Navajo Nation, you look for a mentor or a role model. And one of the people that I've looked up to that I didn't get to meet personally, but is Annie Dodge Wanika. And the reason is because she was a councilwoman with the Navajo Nation. And she worked with the Health and Welfare Committee with that council. At the time when she was in office, there was a big crisis with tuberculosis. And the people did not know what to do. So what she did, she's from the community, she knows the people. She took it upon herself to visit every hogan, every house, and talk to these people and teach them how to care for themselves and how to clean things so that way they do not get tuberculosis. It took a long time, but because she was from that community, she was able to talk to these people, and they were able to listen to her, and they trusted her. I see the same type of model with the dental therapists. If they're from these communities, that this is the kind of approach that they will have. And again, you know, that like as a dentist, you know, I'll be able to focus more on the care that requires more specialty. I'll be able to do the root canals that are needed. I'll be able to do the surgical extractions. If a patient needs dentures, you know, there was a gentleman that came up to our vice president at one point and said that he couldn't get a job because he didn't have teeth. Well, he was able to go see a provider and was given dentures, and now he can actually feel confident and get a job. So this is the kind of things that I could focus on instead of the simple fillings, which usually, you know, they could take maybe 30 minutes or so, but in that time, I could be spending helping a person like that gentleman get dentures. The last thing I wanted to say was that, you know, really it was already hit upon that these dental therapists are going to be there for a long time. They are from there. They don't want to leave home. It's going to provide a continuity of care. It's going to make the community's health more stable as far as dental is concerned. And I really appreciate your time, and I hope that you strongly consider this legislation. Thank you.